So now we're talking about disease, the nature of infectious disease. And first we need to establish disease is defined as any change from a state of health. So if you do not have any change in a state of health, even if you are carrying the pathogen, you do not have the disease. This is very apparent with things like HIV. HIV, you can get in, it can be infected, it can be established, but there at the beginnings, there's not a change in the state of health. Now they're realizing that there's usually kind of a minor thing that goes on right at the very beginning of HIV infection that most people don't even recognize, maybe some flu-like type symptoms. Um, for a few days, but then you can spend days, weeks, months, even years without getting the disease that comes from HIV, which is AIDS. So the disease is what's classified as a change in the state of health. So you can test positive for COVID-19, for the SARS-CoV-2 virus, but not have COVID-19. And that's what they're talking about when they're talking about wanting to sample random members of the population to see how prevalent this virus is in our society, even the ones that are not exhibiting symptoms. So that's what's going on. Right now at this point, they're saving tests for the people who are sick. So we're not going to do that, but as this progresses and as we go through this, at some point they'll be doing a lot more random sampling. Other countries have done some random samplings. If you tested positive, even if you weren't sick, they had you self-quarantine so that you wouldn't spread it to others. Okay, so a disease, a change in the state of health. So do remember now that infection, just because you have the virus, does not mean that you have the disease. So you need to make a differentiation on that, and sometimes lay people don't necessarily make a differentiation on that. So contamination, you have come in contact with it, but if you wash your hands, you may get rid of it. It may not start up an infection. If it doesn't get into your mucous membranes and into your cells. If it does move inside, gains entry, then you have an infection, but you still may not have the disease yet. Disease is classified as when it adversely affects the body. Okay? All right, so, I've lost how to advance my slides. Oh, there it is. Sorry, still learning. Okay, so I think we covered this contamination versus infection versus disease. This is some more examples of that. Okay, so let's talk about disease. How do we know if you have a disease? Well, you're experiencing signs, symptoms, or possibly even a syndrome. So we need to define that. And again, this is another thing lay people don't really understand the difference. There is an absolute difference between symptoms and signs of a disease. Symptoms are defined as being subjective. They're only felt by the patient. An example of this is pain. So pain, this is why you've seen those pain charts on a scale of 1 to 10. Tell me what your pain is. It's because there's no way for the medical staff to be able to tell what type of pain the patient is. It's only what they tell you. So symptoms are something subjective, only felt by the patient, while signs are things that are visible and measurable. So these are objective. Signs of a disease. So in your mind, to keep this clear, signs, think about road signs. If I have a sign or a sign on a business, I know exactly what it is. It's visible, I can see it, I can measure it, I can follow it. Symptoms are things that are just kind of understood and they're not written down. These are subjective. So think of signs like road signs. I can absolutely see it. So in class, we would go through these and you guys would tell me signs and symptoms. So take a second and go through this. Coughing, nausea, pain, fever, rash. What are these are signs and which are symptoms? So coughing, obviously, what's that one? That one is, oh, there we go, a sign. Nausea, just not feeling like you're going to throw up, that's a symptom. I can't tell if you're nauseous. Only you can tell. Only the patient can tell if you're nauseous. Pain, we've already talked about. Fever, fever can be measured. A rash can be observed. Malaise is just not feeling right. Sign or symptom? Okay, symptom. And also think about things that you can measure clinically, but maybe the patient doesn't even know about. This is why medical checkups are so important. You can go in and sometimes we can do some tests, some blood work, listening to their heart, some other types of tests where we can, as medical professionals, not me, but where medical professionals can determine that there is a sign of something coming the patient doesn't even, may not even be aware of yet. So tachycardia, irregular heart rhythms, that can be visible. Leukopenia, if you get your white blood cell counts are different or raised or elevated or out of whack, that can be something that we can tell. So again, this is where normal, regular, routine physicals become important, where you can check some of these things that may not be felt by the patient yet. Okay, so differences between signs and symptoms um, for that. All right, what else do we need to know about that? Sometimes signs and symptoms can occur in pairs, nausea and vomiting. You know, if you've had a kid, you can the fastest thing to get you out of bed is a child standing over you in the middle of the night saying, "Mom, I feel like I'm going to throw up." That's nausea, but we know that vomiting can very quickly follow that. So sometimes you'll see signs and symptoms occurring in pairs. Now, let's define syndrome really quickly. Syndrome is a collection of signs and symptoms that just by themselves, when you put them all together, you can get a diagnosis of a disease. There are a few diseases that can only be diagnosed by a collection of signs and symptoms. Other diseases can, have a test for it or something. AIDS is listed from that. If you get some of these very strange infections that nobody else gets, they may say, oh, let's give you a test. We think that you may have AIDS. This is PCOS, is polycystic ovarian syndrome. If you have a specific sets of signs and symptoms, that can lead to a diagnosis. What we're doing right now with COVID-19, you've seen lots of charts out in the media. What's the difference between allergies versus a flu versus COVID-19? A collection of signs and symptoms. Now, when we're comparing flu and allergies and COVID-19, we're still learning things about COVID-19, and we know that not all patients exhibit all signs and symptoms. And that can be true for any disease. You may have some of the signs and symptoms, but not all. But that does not mean that you don't have the disease. But typically, a syndrome is something where a collection of signs and symptoms can lead you to suspicion that that is the disease. And there are a few diseases where that's the only way we know from that. We've already defined asymptomatic. Asymptomatic is when the patient feels healthy, experiencing no signs and symptoms. You can still be considered asymptomatic even if clinically there are some tests that you can do to give you a diagnosis or something like that. You're still considered asymptomatic if you're feeling healthy and you're not aware of these signs and symptoms. So asymptomatic people who maybe are diagnosed with HIV, they may have no signs and symptoms, but a test can tell you that they are infected with this virus. Same thing with our asymptomatic carriers of COVID-19. Okay, all right, let's see what's next. Oh, that's just some more things. You can go through this chart as well and look at the different types and make sure you understand that.